Anyway. Hey everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Before I introduce today's guest, I'd just like to take a moment to pay tribute to a past guest on Chef AJ Live. Many of you are familiar with Dr. Hans Diehl. I believe he really was a pioneer in the field of lifestyle medicine. He founded the CHIP program, which many people took and was their first entry to healthier eating. It stood for, at first, the Coronary Health Improvement Project, and then it became the Complete Health Improvement Program. He wrote many books such as Dynamic Living, To Your Health, Reversing Disease with Knife and Fork. Oh, my favorite, The Optimal Diet. This one, I have all these books signed by him. Take Charge of Your Health, Dynamic Living. We could go on and on. Health Power. And he was just a larger than life person, a dear friend of mine. He's really the first person that ever gave me the time of day when I started becoming someone in the plant-based world. When I couldn't get anyone to talk to me, he not only wrote the foreword to my first book on processed, he was the first person that said yes when I started producing conferences. And I just wanted to take a moment of silence to honor him. He passed away yesterday. And those of you that knew him know how much we loved him and how his work affected the lives of maybe millions, but thousands and thousands of people all around the world. We thank you, Dr. Hans Diehl, and our love goes to your family. And we have a wonderful guest today. Her name is Dr. Jessica Krant. She comes on the first Thursday of every month. She is a plant-based dermatologist practicing in Manhattan. And I would say she's even beaten Dr. Lyle now. What I mean by that is the most questions we get. And I guess we figured it's because everybody has skin. Please welcome Dr. Krant back to the show. It's so nice to see you again.
Chef AJ, it's always fun to be with you and an honor, as you know. Speaking of people who gave you your first shot when you started entering the plant-based world, for me, that's you.
Oh.
You give me my first shot, and you've always been such a support and mentor, and you're my role model.
Oh my God, thank you. Well, I really, it's so funny because, so many people apply to be on the show, and I'd like to be able to give everybody a chance. It's just hard if I don't want to work like 24 hours a day. But my goal is, at least by the end of the year, to try to get every single person that applied at least a chance to be on once. The problem is they have so much fun on the show. Everybody wants to come on more than once, and that's just not going to be feasible unless somebody else starts another show. But thank you for saying that. We have more questions that we'll probably get to today, but the first one, they actually sent a picture. So I think this is going to be really helpful. This is the first time we've done a screen share, so I'm going to show you the picture and read the question. And here we go. Can you see that, Dr. Krant?
I can see it.
Okay, and so that's what the person looks like now. And then can I move it over, or you're still seeing the same one?
I'm seeing the same one.
Okay,
and
so you see that one, right? And you can see that. So then let me go to the next one, and this is how it's healed. So you can see the difference, right?
Okay.
All right, so you saw it. So basically, this is from Anonymous, and she said that she received an injection in her buttocks from the orthopedic doctor, a steroid injection, and was told to ice it for pain. And that's what transpired. The first picture was taken 3 weeks ago, and this one was taken yesterday. She wants to know if there's any hope that it will ever heal, or will she always have these hideous scars?
Well, in the future, I don't think I'll be able to do this kind of question. I just wanted to say to the audience, because it's a little too close to me diagnosing and giving personal medical advice, which I'm not really allowed to do.
Okay. How about we change the question? What do you do if you get an ice burn? Would that be okay?
Yes, because I don't know what those marks were caused by.
So she said it was caused by ice. When
okay.
She iced it, the shot. She said she got an injection and she put ice on, and it looked like, I think she said, an ice burn.
All right. So an ice burn is like any burn. It's like a chemical burn. It's like a sun burn or a burn from a stove. It can damage the skin and scar it. if it's a deep 2nd degree or 3rd degree burn, which means deep blistering or damage to the actual deeper tissue, that creates the scarring. If it's red and then heals with discoloration, that could be considered a 1st degree or light 2nd degree burn. Unfortunately, it leaves what we call post-inflammatory hyperpigmentation. And that's true of any type of skin injury that heals later with brown discoloration. There's nothing special that could be done about an ice burn compared to other burns. So at this point, it might be time, keeping out of the sun, skin moisturizers, and maybe moisturizers that have a light exfoliating ingredients like lactic acid or ammonium lactate, or potentially a salicylic acid gently applied inside a moisturizer. But otherwise, and if it goes on persistently long term and someone is very motivated to work on it, it might require laser, in which case I really recommend a board certified dermatologist or board certified plastic surgeon, somebody who has extensive experience in laser, because in this case, treating discoloration with laser has a risk of creating new or worsening discoloration. So it's not something to be taken lightly and should be evaluated in an office by an experienced board certified derm or plastic surgeon. And I hope that it does get better by itself over time.
Right. Yeah. Could she have, or should she have just gone right to the emergency room? Would they have been able to help with that? Or
I think once the burn is, happening, it's a matter of managing afterwards. So I don't really know if going right away would have made a difference, but possibly. I guess going early is good because you don't always know exactly how deep the burn will end up being. So it's good to get, help early.
Right. Well, thank you. Okay. Here's a timely question from Lisa about sunscreen, because I noticed that Dr. Greger is going to be doing a whole webinar about it. And she wanted to know, is it necessary to wash off water-resistant sunscreen from the face and body at night after wearing it during the day? Does the skin need some sort of a break?
It's better to wash it off and not go to sleep with chemicals on your skin, because even supposedly quote unquote chemical free sunscreen is a lotion with chemicals, and the molecules that block the sun or resist the sun happen to be physical blockers rather than the more worrisome chemicals. But there are other chemicals in the product. So it's just like a complicated moisturizer with extra ingredients that do affect your skin. It's better to wash it off lightly if possible. But if you go to sleep once in a while with it on you, I don't think you'll ever notice the difference.
Right. Oh, and probably the same as what you would say for makeup, which I never wash off.
Well, Chef AJ, I have a feeling your makeup is relatively, so to speak, clean and not damaging your skin or your endocrine system as much as some other products might. And as well, speaking of absorbing it into the body, we always have to think in terms of surface area to volume ratio, and putting it all over our whole skin is different because a lot more surface area is touched with the chemicals and may get absorbed in. But if it's just the face on our grown-up adult-sized bodies, it's not as much of an issue in terms of the absorption.
Great. I try not to wear that much. Anyway, thank you. This question is from Benito, and they're asking, what products might you recommend to treat hidradenitis suppurativa and scarring?
Hidradenitis suppurativa is, I think we've spoken about it before on your show, Chef AJ. It's an inflammatory autoimmune dysregulation that affects the sweat glands under the arms, in the groin area, potentially under the breasts. It can cause deep and painful cysts. And if the cysts are there long enough, they can connect together under the skin and cause what we call tracts. this eventually, if they sit there long enough, can become scarring and turn into scars. It's painful, it's uncomfortable, they get infected, you know, it's really a terrible condition. It can range from very mild to very severe and really life-altering, because it prevents people from being able to participate socially and feel comfortable. So I think it's a very serious medical condition, and you should be seen in an office by a board-certified dermatologist and or rheumatologist, you know, for the autoimmune aspects. It may require some of the newer systemic biologic medications. If you want to do as much as you can at home to manage it yourself and try to improve it on your own to minimize the need for medications, topical or systemic, there has been some research that shows a link with weight. For some people, losing weight reduces the inflammatory burden on the body, and also eating a healthy anti-inflammatory plant-based diet may reduce the inflammatory burden on the immune system and reduce the inflammation involved. Studies have also shown that smoking cigarettes is directly linked to flaring of hidradenitis, and also dairy. Dairy, brewer's yeast, which is the yeast that is used to make beer. There's some studies that indicate baker's yeast, which is the yeast used in rising bread and other baked goods. And dairy is inflammatory in the diet. So dietary changes, smoking cessation, and just trying to do your best to you know, increase your metabolism, work on overall weight. In individual people's specific cases, those things may help.
Great, thank you. People are still saying one day they'd love for you to just do like a product overview of just in general products that you like, you know?
I'll work on it. You know, I'm not a product maven like some other internet star dermatologists are. I know a lot more about the internal body system and how our diet and lifestyle affects our skin health, because I'm certified in lifestyle medicine. But I will do my best, everybody, to put together a little product show one day. I can definitely put together a show about ingredients. And
that'd be cool, because you know what they say, you may not be an authority, but you know what you like.
Yeah, ingredients and what they might mean, what you can look out for. I may not be able to talk about brands, but you guys can figure that out. But I do want to say, while we're talking about your audience paying so much attention, which I really appreciate, Chef AJ, I met some more new patients in my office this week that met me through you and your show. So it's really
amazing. I mean, you just, you know, sometimes I think, is anybody watching? That is very cool. I'm so happy to hear that.
It's really such an honor, and, you know, just makes me smile every time when they mention your name in the office.
Oh, that's great. Well, thank you. All right. And thank you for doing this. So the next question is from Linda, and she said, would you recommend electrolysis for upper lip hair removal? I don't believe laser hair removal is permanent. And before you answer, I just want to say, when I was much younger in my 20s, I tried to have some electrolysis, which, by the way, hurt like the dickens, and it didn't last, and it was quite expensive. But I've had laser hair removal for places that I don't want to have to deal with, you know, and it didn't hurt, and it's never come back, like, ever.
They both have pros and cons. I will say, for both of them, both electrolysis, which is using a little electrical current down the hair shaft into the follicle to kill the root, and using laser, which is using a wavelength of a light with a true laser beam that targets that hair bulb color and is attracted to it, heats it up so much that it kills the hair root and kills the follicle. Both methods are among the only methods of hair removal that might be permanent. And they're among the only methods that actually stop the hairs from trying to grow, which is the key, because methods like waxing and sugaring allow the hairs to continue to try to grow from underneath and cause a lot of ingrown hairs. So one of the benefit of laser, with the correct laser, with hairs that will work, which are darker hairs, and with somebody whose skin is far enough in color away from the hair color that the laser can recognize the hair color and not burn the skin at the same time, those people would be ideal for effective laser hair removal that could approximate permanency or at least be permanent reduction. Sometimes it does work for a year or so, and then it requires once or twice a year a touch-up treatment. That's just realistic. Sometimes it's permanent. But the hair has to have a color, and ideally the darker the better. So the lighter the hair gets, the closer to blonde, the closer to gray or white, the less the laser beam is able to see a target at all, and then laser won't work when the hair is too light. There have been some attempts to create a system that can dye the hair follicle base with a dark color inside the follicle to attract the laser beam, even if the hair is not a dark color. But I don't think those have been proven to be that reliable yet. So electrolysis comes in because it's easy to target a single hair. So if you have like 1 or 2 hairs growing out of a mole and you don't want to do laser, electrolysis works well for that. Or if your hairs are not good targets for a laser beam because they're too light, or if you're somebody who has dark enough skin that the hair color and the skin color are very close together, and it's risky because it might burn your skin to laser them, electrolysis could be an option for you. So there are good cases for electrolysis with an experienced electrologist, and there are good cases for laser, and both are good options.
Nice. I got mine on a Groupon, and it was great. What can I tell you? My laser. So it was done by a nurse practitioner. I mean, it was not like, it was a real person in a doctor's office kind of thing.
Each state has different laws about who can operate a laser and who can do hair removal. And some states, for example, New York, many years ago got a law passed that equated laser hair removal to waxing. So laser hair removal got sort of under the radar, so to speak, in terms of a lot more people are allowed to do laser hair removal in New York. But the other uses for those same laser devices are restricted to physicians, or their direct delegated operators in their offices. So check your own state and just make sure you go to a place with experienced people that are properly licensed.
Great. As for everything, though, right?
As for everything.
Yep. Colleen says, I'm 70 years old. Should I be using a chemical exfoliating product to help my skin texture, sunspots, etc.? And how often and what type? And maybe you could explain, because what does she mean by chemical exfoliating product? Are there exfoliating products that are non-chemical, for example?
Colleen, I do tend to prefer what we call chemical exfoliators because the alternative is mechanical exfoliation. And the difference is that mechanical would be like physically rubbing the skin. In the 70s, we did that with the Buff Puff. And that was sort of, the drugstore version, and it worked very well. But the problem with rough physical exfoliators is that you can physically injure your skin. You can trigger additional inflammation. And it's basically like sanding your skin. What can happen is that it will force your skin to let go of more keratinocytes that are the surface skin cells than your skin is ready to let go of. Your skin will read that as injury, and unfortunately will compensate by starting to overproduce keratinocytes. And that will make you feel like you have extra skin, dry skin, flaky skin, and that you feel like you need to exfoliate constantly. So it's a little bit of a vicious cycle. I prefer to be more gentle with the skin and do gentle chemical exfoliation once in a while, a couple times a week, a couple times a month, which are things like the alpha hydroxy acids and beta hydroxy acid. The only beta hydroxy acid that we use is salicylic acid. That's the one that's in a lot of acne products. It also helps treat acne. Alpha hydroxy is just a different formula of these molecules, includes glycolic acid, lactic acid, and ascorbic acid, which is vitamin C. But it's important to be careful to use gentle, low percentage products until you are comfortable with what you're doing with your skin and you know what you're doing. Some of the chemical peels, which are what a chemical exfoliator sounds very gentle, but it's the same thing as a chemical peel. And those can be from superficial and gentle and, almost daily to a couple times a week use at home, all the way to a chemical that can burn your skin and permanently scar it and should not be done at home. And unfortunately, those are now available on the internet. So you have to be careful of what you're buying. Don't try to do a medium or deep chemical peel at home. You will injure and damage yourself, and it's pretty much permanent. That most doctors cannot fix those.
Oh, wow. That's scary. Huh?
So start with a gentle, low percentage glycolic or salicylic acid. I think that's the best bet.
Great. Thank you. The next question is from Anonymous. And she says, after running into an interview with Chef AJ, I watched her talks and went to 54 kg to 48 kg in less than 3 months. So that's 6 kilograms lost. That's about 13 pounds without even trying. My skin couldn't keep up with this speed and it sagged pretty badly, both on my face and body. I'm 62. What can I do about it?
Skin tightening is unfortunately not easy. And there are not really many products that truly tighten the skin. And a lot of the devices that doctors are using in their offices might tighten it a little bit, but the truth is that they don't tighten it extremely to an extreme. So products that thicken the surface of the skin, these glycolic and salicylic acids, lactic acid, and retinoids, the vitamin A derivatives, help to sort of thicken the dermis and thicken the epidermis. But if the skin sagging is extreme as we get older, our skin doesn't.
AJ Live. I'm your host.
Our skin doesn't snap back as quickly. So at some point, if it really is loose and sagging, it might be worth consulting with a plastic surgeon, unfortunately, for maybe a mini facelift if it's extreme. But there are devices in the office that you could consult with that do everything from a little bit of tightening from the outside, like Ultherapy is ultrasound heat, Thermage is radio frequency. There are radio frequency energy microneedling devices that poke needles through the skin and put a little heat under the skin to tighten. There's a procedure called Elicor, which supposedly takes little tiny microscopic core samples out of the skin to shrink it back on the side. And there are other devices that can go under the neck and tighten. ThermiTight is one of them that puts a probe under the skin that measures heat so that we don't overheat the skin and can tighten a little bit that way. It's just important to have your expectations tempered, so to speak, no heat pun intended. And consider that if you don't want to pay a lot of money to repeatedly do those, it might be worth a small surgical procedure.
It just seems that people don't want to age, or they don't want visible signs of aging.
We're going to try to figure out a balance, right, Chef AJ, where we're happy to be aging and we're happy to be healthy and we look our best doing it. Plus, we do a little bit to keep ourselves looking refreshed.
Yeah. Well, I find that people that have a lot of work, they don't look normal anymore. I don't want to mention any celebrity names, but it gets to a point where they don't look normal.
Well, that's what we try to avoid. I always, talk to my patients and reassure them that I will not let them start to look weird. And I'll say no if we start talking about things that might alter their natural look. I want my patients to look refreshed, well-rested, younger, healthy version of themselves.
Yeah, great. This question is about Vaseline. It's from Nancy. Dr. Krant, what do you think about using Vaseline on your face at night? Is there a reason not to? I knew someone who did and had almost no wrinkles on her face at 100.
I personally am a big fan of Vaseline. And I always like to say that around the turn of the old century, the previous century, all the big studio movie stars said that that was their secret. That was their beauty secret, is that they put petroleum jelly on their faces. It is the purest form of skin barrier protection. It's extremely gentle, and it allows optimum, maximum hydration of the skin, which is why it does keep a glow and a translucency about the skin. It's a distilled, purified petroleum product. It is what's left over after they take out all of the impurities, but it does come from the ground, which is a mix of plant and probably old animal, debris processed over millennia. So it's up to people individually to decide if they're comfortable with that.
But you're not supposed to put it in your nose, right? At least that's what Dr. Greger said. But a lot of doctors I've talked to say it's okay to put it in your nose if your nose is dry.
I think that there's a spectrum there. I'm sure if it's a very thin layer and it's once in a while, it's okay. Dr. Greger was trying to warn people off of consistently every day putting globs of Vaseline in our noses because as he's correctly said, we don't want to breathe in the melted Vaseline because it can cause oil lumps in our lungs, which are not dissolvable and can cause something called a pneumonitis, which is an inflammatory lung condition that can be very dangerous.
Got it. Thank you. This is from Sherry. I follow a strict whole food plan exclusive SOS free diet since 2018. I know it's important to take B12 as a vegan, so I take the one Dr. Goldhammer recommends, pure encapsulations, methylcobalamin 1000 micrograms. However, it makes me break out with cystic acne. Any suggestions? I've cut it down to a couple times a week, but I still have the occasional breakout. I also apply benzoyl peroxide to my face daily as a preventative. Thank you.
It's true that high doses of vitamin B12 have been linked to inflammatory acne. So I don't know if there's a way to change the formulation or reduce the amount in each pill that might make a difference, or if there's something else going on that could also be related to the acne. It's a little hard to be sure that it's just the B12. But I would say trying to reduce the dose, or maybe taking it within a B complex or multivitamin, or seeing a dermatologist to see if there's anything else going on that could be potentially related to the acne too.
Well, pure encapsulation makes drops, and with drops, you could titrate even like the smallest amount.
Right. And as we know, we really need the very smallest amount. Most of these supplements are far more than we actually need on a daily basis, but we don't absorb it very well. So different formulas need different dosages, and maybe something could be figured out. I don't know the exact answer of what to do specifically.
Great. And yeah, you don't have to take it every day for most people. It's too much, actually, sometimes. All right, here's a question from Mary. What is the best way to get rid of the brown age spots on a person's face? Is there a cream or prescription rather than freezing it off? A dermatologist recommended freezing, but I'm afraid that'll just create more problems and possibly come back darker, or I'll be more susceptible to skin cancer.
It is true. And the reason this question comes up every time we talk, Chef AJ, is that turns out to be one of the things that bothers people the most. We would think that we're bothered by wrinkles or sagging, but when they did a research study asking people to rate how old people looked in photographs, it actually was the brown spots that people responded to the most. So that's why it does bother us so much. They're not easy to cover. and they are unfortunately hard to get rid of. So freezing is one option. The problem is that the pigment that causes these is in the skin. It is the cells. So it's not something on the surface that can easily be peeled away. So the treatment does have to lightly damage or fade the actual cells that are in our skin. This can be done with a very light freezing that might peel off the pigmented cells. After that, though, that patch of skin must be kept out of the sun completely for probably a couple months so that no pink skin gets touched by a ray of sun, to allow it to try to heal without repigmenting, as she asked. Laser is another option. Laser may work. It may temporarily fade those spots, but they also are at risk of coming back again. It's true. There's no great proven definite guarantee spot treatment or product. There are some skin bleaches, skin lighteners, and even a topical retinol, which is the over-the-counter version of retinoid, kojic acid, azelaic acid. These work in multiple ways and multiple pathways to help lighten the skin. Topical tranexamic acid, which is often abbreviated TXA. These all help to lighten pigment in the skin, but not necessarily the type that's causing these sunspots, which are called lentigos. The lentigos are truly small growths in the skin, as opposed to something like melasma, which is just extra pigment in the surface of the skin that can be faded, but is also complex because the process that creates it is hard to stop. So pigment in the skin, especially of the face, is frustrating. But one key to know that's new information is that we used to think that ultraviolet rays, the UVA and the UVB rays, were what is causing these. And if we just wear sunscreen and block the ultraviolet rays, we will be able to fade them. We now know that visible light rays are also causing these, which means the light that we see with every day, light that lights up the sky, that lights up a room, those are the visible rays. Those are the rays that when you break them apart in a prism, they create a rainbow. All those colors together make visible light. And that visible light touching our skin also promotes and triggers this pigmentation. So in order to have the best shot of holding it back, slowing it down, or fading it while we do other procedures, it's best to wear enough sunscreen with tint in it, unfortunately, that contains an ingredient, if possible, called iron oxide, because this new ingredient is the one shown to best block the visible rays. Iron oxide does not come in any sunscreen that's untinted, because iron oxide is rust, if anyone recognizes that formula. So it is brown. It comes in tinted sunscreens. And the last piece to keep in mind, which I tell my patients, which they are not happy to hear, is that if I can still see your brown spots through your sunscreen with my eyes, so can the rays of light, because that means the rays of light are hitting your skin and bouncing back to my eye. So they're going through that sunscreen and coming back. So if you really want to do as much as you can to help every brown spot fade, you have to be wearing this tinted sunscreen so thickly that no one can see the spots. I mean, that's a lot to ask of people every single day. So take it with a grain of salt. We do the best we can, but that's the truth.
Ay, ay, ay. The sun seems to cause so many problems for people. Yet they say we need it, but it really does damage your skin, I think, more than, well, smoking in the sun. Smoking in the sun would probably be the worst. Drinking and smoking in the sun. That would
Right. Sounds like a beach party, but no, we're not doing those anymore. So drinking and smoking, absolutely terrible for the skin. The sun, terrible for the skin. And you're right. I think we want to protect our faces. I think we should protect our necks and our chests, our hands, but we also do want to be outside and be active. And the sun, as we've talked about before, one of my favorite topics as a dermatologist is the fact that the sun, scientifically it is proven to be healthy for us to have a little bit of sun on our skin. So we have to balance.
Yep, makes sense. Okay, again, another. I swear the hard part about medicine is these to pronounce some of these conditions, which I'll probably botch. From Lauren, I've developed a skin condition that has been difficult to get rid of for the last 3 or 4 years. I suffer from granuloma annulare on my hands, which was confirmed via a skin biopsy. It's affected several fingers, index finger, edges of the top of the fingers, knuckles on both hands. It's very painful. And at the same time, I developed Fox-Fordyce disease with painful rashes under both armpits covering them. And she's been a dermatologist over the years. Nothing has been successful at managing or curing or finding underlying reasons for these skin conditions. Steroids, both topical and injections, have not helped. The injections temporarily help, but now it's even more sensitive. She says she's whole food, plant-based, no processed foods for decades, suffering from hypothyroidism for decades, elevated total cholesterol, had Lyme's disease, has some antibiotic allergies. So she just needs some help. What about a water fast? When you got all that much going wrong with you, what do you got to lose, you know?
Right. This is, both of those conditions are complex. And sometimes when we don't find the source, it can be very frustrating. Unfortunately, in this forum, it's a little too hard for me to really say what to do. But I do know that granuloma annulare, I'm sure she knows, has been sometimes noticed to be a harbinger of future autoimmune diagnoses and future diagnosis of diabetes sometimes, but 10 years before a diagnosis. So it's of course important to just keep an eye out for that. But otherwise, sometimes people do have to resort to systemic medications that reduce the immune system's activity to get these things under control. Those are areas that I'm not as familiar with, because that's not really my field of practice in dermatology, but I do know it's very upsetting and frustrating.
Great, thank you. Susan wants to know how you can get rid of brown age spots on the upper lip. Probably the same way you would get rid of them anywhere, right? I mean, is a lip particularly more sensitive or different skin than anywhere on the face or body?
Well, brown age spots can either be as the lentigos that we talked about, which are the actual growths that are in the skin, or a upper lip is a very common location for melasma, which is the hormone related and very genetic tendency to hyperpigment. Also, it can be triggered by pregnancy and other hormonal changes. So upper lip pigmentation, it depends what's causing it. But again, 100%, there's no question, having it completely blocked from any light exposure is the #1 baseline. Depending on the type of pigment, lasers, followed by this type of diligent sunscreen and the skin lighteners. Examining medically to make sure there's no hormonal pressure creating it. And the difficulty of the upper lip is that we sweat there a lot. It's really hard to keep sunscreen on the upper lip. It's an area that sweats easily and sweats the sunscreen off. Or we eat, we rub our lips, we lick them, and it's hard to keep sunscreen on that spot. So frequent reapplication, trying to protect it from the sun with hats, and doing all of the other stuff. Without seeing it, it's hard to be sure, but we would have to try everything. Unfortunately, there's no magic formula.
Thank you. Its next question is from Carol. She says, I'm 63 years old, and while I still have a full head of hair and don't seem to be losing my hair, at the temples on both sides, it's like it's receding and it's making my hair funky. She wears a short haircut, and she's wondering, is that a normal consequence of aging? Is there anything you can do to mitigate receding hair? And, she puts everything whole food, plant-based, SOS free for years, yada, yada, yada. So
hair loss can be hormonal. It can be part of being post-menopausal, and it can be very genetic. So hair loss is extremely complicated. And one of the things that can cause increased recession in the temporal area, these temples here.
Yeah, that's where she's showing it in the,
right.
It's like literally here and here, nowhere else, just like here and here.
It can be your genetic pattern of hair loss. But one of the things that can be related there is low iron. So iron deficiency can show up as thinner in the temples than normal. So that's one thing to check, especially on a plant-based diet. Also check vitamin D, check thyroid, check vitamin B12, selenium, magnesium. There are a lot of minerals and vitamins that go into supporting healthy hair, but iron would be my number one thought, just to double check and check the ferritin level, not just the blood iron levels, because ferritin is the iron stores inside our bodies. And when the blood iron in the blood is low, we replenish it with our ferritin stores. So if the ferritin is depleted, that means that we've had low iron and iron deficiency for a long time, and we have depleted our own stores of iron, and we're losing the race. So we need external help. Do not supplement iron on your own without having your levels first checked. It can be dangerous to have too much iron. So it's not something to just take like a vitamin off the shelf without checking.
Perfect. Thank you. Now, this question has to do with cold weather. And you're like, why are you asking in August? Because we have questions going all the way back to April that we're saving, because that's how many questions you get. So we're going to answer it today. It's from Stephanie. And she said this time of year, because she wrote this in April, when it's so cold outside and I have the heat going on inside, I get skin splints on my hands, normally my thumbs. The skin around them seems to get thick, but it doesn't seem to heal. I cook everything from scratch and produce prep often, so I'm constantly washing my hands, and I don't like to put lotion on and have greasy hands throughout the day because it makes me wash my hands even more often to get the grease off before I touch anything. At night, I slather my hands in lotion and put on sleep gloves, but in the morning, I feel like I have to wash my hands with soap a couple of times to get the grease off. Is it worse to wear sleep gloves with your hands in lotion overnight, but then have to wash your hands a few times with soap in the morning? Or should I just sleep with the dry skin? Any suggestions would be helpful.
Well, Chef AJ, I think maybe some people will also watch this coming fall and winter. So we're year round here. Unfortunately, Lisa, there's no getting around the fact that the surface skin being dried out will cause the cracks, and they will not be able to heal unless an artificial barrier is placed on the outside of the skin, which will hold in the moisture that is escaping through these cracks. That is true of eczema. It's true of the cracked, split fingertips. And it's true when your heels are cracked as well. The skin cannot fix itself from the inside if the same things are happening every day that are drying the outside surface. I heard in that description a lot of hand washing. And if you're somebody who feels very uncomfortable with a little bit of moisturizer on your fingers, you're going to be in trouble, because constantly feeling like you have to wash off the moisturizer is what will keep you in the difficult state of having the finger cracks. With the cleaning and preparing of food and doing dishes, the number one first thing to do is get over hating wearing gloves and start wearing big rubber gloves. Try to find ones that fit your hand well, but you must wear the thick kitchen gloves that have a little cotton lining, because if your fingers touch the moisture, the moist food, the moist sponge, the moist dish, that dries out the surface. So we have to stop the damage by putting on the gloves. And I tell my patients, you're not allowed to even wash one dish without gloves. You can't just quickly wash one dish, because it's never just quickly one dish. It's a quick rag, it's a quick sponge, and all of that soap and water exposure, just the water itself, dries out the surface skin. The underneath skin isn't dry, so the surface skin shrinks and it will crack. Once that crack starts to go deep, it can't fill in and heal itself while the outside is dry. So number one, gloves. Number two, there are a few hand cream formulas that are halfway between a greasy Vaseline ointment and a thin, watery lotion. The greasy Vaseline ointment we won't do because it's too greasy. We don't want to touch anything with it. And the thin, watery lotions, unfortunately, dry our skin out more. We need something that's halfway between greasy and a white cream that will kind of soak in and feel silky, but look invisible And that silky feeling, we do have to get used to. And it doesn't matter if that silky feeling touches a little food or something like that, because we're going to be wearing those gloves. And another secret I tell my, two more secrets I tell my patients for this condition. One is when we wash our hands, get over the idea that you have to wash all of that cream off completely to be clean. It's damaging to the skin and it's too stripping. And I think Lisa said she washes her hands a few times just to wash off that grease every morning. It's never going to work. I would say change the mindset to feel like you're washing germs off the outside of the cream, but know that there might be a little cream left and that's clean. And then you're going to just put a little new cream on right away. That's what we have to do, unfortunately. Clean the cream, but leave the cream there a little bit and put fresh cream on every half hour. That cream, invisible, silky layer has to be on your skin 24 hours a day, around the clock. You can never feel like your skin is dry. It can never sound dry because that's dry and it will be getting worse and cracking more. As soon as you squeeze your fingers together, they're going to crack. It's just, unfortunately, a medical condition, and now it needs a medical treatment. And one other trick for people who are not so worried about the feeling of being clean, but who are worried about germs, who come to me with dried out, cracked hands, I give them some mental relief by saying, you know, there comes a point with the hand cleaning where the skin is so rough and cracked that germs will actually get stuck in the rough texture and stuck in the cracks. So you're worse off when your hands are too clean and the skin is unhealthy. That will hold more germs. It's better to have a well-sealed, rubbery, healthy layer of skin that's a barrier, that's a true intact barrier that germs can sort of bounce off of and are easily wiped off of. Will have fewer germs than overly washed, dried out, cracked hands. So those are all my hand secrets.
Right. So are there better places to live in the United States so that your skin can be its best?
Well, it's absolutely true that, you know, in a dry climate, a desert area or areas where it's less humid, the air is so dry that just living, you're getting constantly dried out. Your moisture is evaporating from your skin and your body all the time. So, you know, that's why in the summer, this happens a little bit less, because in summer, the air tends to be more humid. There's more moisture just around us, and the pressure to suck moisture out of our human skin is much less. But in the winter, in the dry winter air and dry climates like the desert, we get dehydrated very quickly, and a lot of that moisture comes right out of our skin. That artificial barrier is even more important in dry climates. It has to be on us all the time to block our own body water getting pulled out of our skin all the time.
Yeah, great. Thank you. This is from Nirma. Is there a filler such as Juvederm that has not been tested on animals? And if such a filler exists, is it available in the United States?
Nirma, I am unfamiliar with whether that exists. And I just like to point out that although we want to protect animals for sure, filler is a foreign substance that is injected by needle or by cannula with needle holes first poked under the surface of our body. So it is extremely high risk for infection, for inflammation, and it's like a surgical device. It's like having a shoulder replacement or a knee replacement. It's like having a pacemaker put in your heart. It's a foreign, non-human medical device, and that's how the FDA regulates it. It's actually considered a medical device, not a drug, that is put under our skin. So it would either, for safety, have to be tested on animals or be tested on humans. And so far, I'm unaware of a government or a place that would allow only humans to be tested without any animals having ever been tested before. I just don't think for safety reasons that would be legally allowed. So I'm not familiar with where that might exist anywhere. If there is a new branded filler that ever comes out that says it was never tested on animals, I can just only imagine that it's because they're using basically the same exact formula that someone else had that was tested on animals. So I don't think we'll ever really be home free. I know some people watching must be thinking, well, there must be a way to test it versus in a robot or a computer simulation or artificial skin, but I don't think we're scientifically sophisticated enough yet to try that and, be able to trust it for safety. So I don't think so yet.
Yeah. And often the ingredients were tested on animals, even if that, you know what I mean? Even if the whole component wasn't. Does that make sense?
Absolutely. True of cosmetics, true of skin creams, it's very rare these days to have ingredients that were never tested on animals in the past. So someone else already figured out that it would be safe for us, even if a current company doesn't test their formulations on animals, they are benefiting from that having been done.
Exactly. Yep. Marcia says you sort of answered this a little, but then there's a couple of different nuances in her question. She's wanting to know, she's 71 and she wanted to know what the best treatment for saggy skin on the face is. She uses Trent, I never can say that word, but you know what I'm talking about. 0.01% every day for a year and has gotten the Diamond Glow facial also. Is there anything else I can do to help this aging issue? Do you know what the Diamond Glow facial is?
I believe the Diamond Glow facial is something like a facial with a little device that's a little bit exfoliating and has a little suction. There are a few different brands of this. It's like a little micro dermabrasion with a little vacuum on it at the same time, like if done gently, a lovely facial. It is that mechanical exfoliation that I warned about earlier. So it should make sure it's done gently. It can cause scarring if done too roughly. Between gentle exfoliating and using a topical retinoid like tretinoin, I think that's a great start for what you can do that's not surgical. Other than that, it would be getting into devices, tightening devices that we talked about that deliver heat and energy to the dermis underneath the surface of the skin to try to do a controlled injury that will result in damaged collagen curling up and tightening up and trigger the formation of new collagen. All of these procedures that we do are different versions of trying to create a controlled injury to force new collagen to get created, because new collagen and elastin production slows down with us over time. Tretinoin and the retinoids, actually, tretinoin is the only FDA approved molecule for wrinkles and aging skin. It's the only one that bothered to go through the FDA process. So we actually have proof that tretinoin, the topical retinoid, goes through the skin and does signal in the dermis to create new collagen. So it does work. Other than that, surgery might be one of the only options other than those heat generating devices and some of the topical retinoids.
Great, thank you. So this next question it's funny because the first question where we showed you the burn, there was a second part of her question because she said, what can I do about all the cellulite on her buttocks? And she said she gave her height and weight and she was actually very, very thin with a BMI of 18. And then we have another question from Laura. Is there anything you can do about cellulite?
I would say there is nothing that can truly be permanently done about cellulite that is simple and reliable. But again, these types of repeated controlled injuries may make it a tiny bit better. There are a lot of different devices that try to go under the surface of the skin and trim or cut a little tether that might pull down a single dimple, and it may help that dimple raise up. So individual dimples, there are physical procedures that are surgical procedures that can be done in the office. But as far as the overall rippling effect, it is frustrating. There are a lot of the creams they use try to dehydrate that fat tissue that's under the skin. And so dehydrating it kind of does flatten it down a little bit, but it's temporary. other than that, I know there are so many devices out there on the social media. I've seen them being advertised. I'm sure that in a way they all help very temporarily. If you do them every single day, the appearance of it will appear better. But I think ultimately it will revert to its genetic and hormonal self. 90% of women do get some version of cellulite, even if we're slender. It's just very hormonal, it's very genetic, it's very natural and tough to beat.
Nice. Okay, I know you have a hard stop, so let's see if we can sneak in one more from Elle. I have eczema and I'm completely vegan and gluten-free and mostly whole food plant-based. Whenever I start to eat cleaner than I am, I get these huge flare-ups and numerous new rashes that last for 1 or 2 months longer. Why is that and how do I push through? That's weird that when she eats cleaner, she would get it versus most people would say when I eat less clean, I think, Well,
the word clean doesn't have a scientific definition. So we all mean something maybe slightly different when we say that. For some people, eating clean may mean 0 oil. And for her, maybe she thinks it means 0 foods with any natural oils or fats. I just don't know. So it is possible to eat too little healthy fat and healthy oils. I mean, I don't mean extracted processed oils, but foods, whole foods with natural oils. Those are important for hydrating of the skin and hair and the nails. So it's possible that there's too little natural healthy fat in the diet. But other than that, a dietitian might have to see what's being eaten. If she doesn't eat any nuts or seeds and no avocado, maybe there's not enough healthy fats to produce the natural moisturizing factor, which is a molecule that's in our skin. We need a healthy skin barrier that has natural oils in it to be able to seal in our moisture. The other thing that very healthy people do often is take extreme care of their skin. And that can be a lot of cleaning, a lot of exfoliating, and that can also cause injury and dry patches. So sometimes when people get back on the health wagon, they start taking such great care of everything that they may cause a little bit of self-injury without meaning to.
Nice. Well, thank you. Thank you for your passion for healthy skin and glowing from within.
Oh, thank you so much for having me, Chef AJ. I always feel like we're not done with the conversation. So I look forward to being with you again someday.
Right. Well, I think we're pretty much caught up with the backlog of questions, which means you guys that are watching live that put questions in the chat, if you would just submit them, we can keep them in the queue. Just to do that, sign up for my newsletter at chefaj.com. Once a week on Saturday or Sunday, we send you the lineup and you respond to that email and we keep it until it's answered. Thanks so much, Dr. Krant.
Thanks for having me.
Always. And thanks all of you for watching another episode of Chef AJ Live. Please come back tomorrow at 11 a.m. Pacific time when my guest is Dr. Nikki Davis for her regular show, Plant Fueled. And she's going to be making, I can't pronounce it, but black bean enfrijoladas. I don't know what that is. Maybe it sounds like an enchilada and I don't know, a frijoli. We'll see tomorrow. Thanks, everyone.